On May 8, UNFPA organized a high-level advocacy event around its flagship report, The State of World Population 2019, bearing the theme Unfinished Business, the Pursuit of Rights and Choices for All. The event saw participation of high-level stakeholders from government, civil society, and other stakeholders. The event was also used to mark two important milestones in the field of reproductive health and rights: the 25th anniversary of the International Conference on Population and Development, ICPD, and 50 years since UNFPA began operations.
Today's event is also a moment of reflection and celebration for UNFPA and the ICPD agenda in Ethiopia. I could not resist to reach out to my predecessors who have led the way for UNFPA's program in Ethiopia over the past 25 plus years, and to recognize the contributions of many of our own staff, but of course the government, CSO partners and development partners in Ethiopia who have relentlessly supported and advocated for the implementation of the ICPD program of action in Ethiopia.
Indeed, the Federal Democratic Republic of Ethiopia has already committed itself to supporting the pursuit of rights and choices for all, women's right to family planning, education, information, and capacity building. The ongoing empowerment of women in Ethiopia has recently demonstrated through their appointment to senior policy-making positions of the government, including the presidency of the Republic, and 50% of cabinet position is a further demonstration of Ethiopia's commitment to enforce our pursuit of the unfinished business, the pursuit of rights and choices for all.
The State of World Population 2019 confirms that more women than ever are able today to claim their rights and have real choices in their lives, and that we have much to celebrate. But the report also tracks the barriers women and girls have faced over the past decades. It shows how governments, civil society, and organizations like UNFPA came together over the years to overcome these obstacles.
There have been major obstacles along the way, and the report notes that gender inequality is probably the foundation of so many of these obstacles to rights and choices of women. Gender unequal norms and attitudes are often used to rationalize control over women's sexuality and reproduction.
Activists, advocates, governments, and organizations like UNFPA have pushed relentlessly for the transformations we see around us today and have helped tear down the ever-changing social, economic, and institutional barriers that women have faced in exercising their reproductive rights over the past 50 years.
Over the years, and especially since the '94 International Conference on Population and Development, governments, civil society organizations, and institutions like my own, UNFPA, helped tear down barriers that stood between women and girls and their rights and choices. At UNFPA, we have set out to achieve 3 transformative results by 2030, namely ending unmet need for family planning, ending preventable maternal deaths, and ending gender-based violence and practices that harm women and girls in an effort to fulfill the promises of the ICPD program of action.
We will encourage governments to make commitments to achieve these 3 zeros in their own countries and to finish the unfinished business of the International Conference on Population and Development. The struggle for rights and choices is ongoing.
The high-level advocacy event hosted a panel discussion around the theme, The State of World Population 2019. The panelists drawn from government, civil society, and the youth spoke on issues highlighted in the report.
I would like to see, especially, all unmet needs are met in terms of family planning and RH. So in our country, we have around 22% unmet need for family planning, which means 2 out of 10 women of reproductive health are not, their interest is not met now. So we have to work on that. Especially we have some strategies to address or to meet the unmet need for family planning and RH. Still, we are striving, but we have to double our effort and achieve those areas. So, in terms of the same maternal days, still we are behind. So, we have to work in those and the gender-based violence areas.
As a result, more women today have access to information and services they need to decide for themselves whether, when, or how often to become pregnant.
You know, I can say that ICPD really came at the right time for Ethiopia because we are in the mood of big change in transitional government. We had new policies like population policy, women policy on Ethiopian women, health policy. So many policies were new, and we are just on the the implementation of all these policies.
So we gathered young people to sit around and say, what is your priority? What do you want mentioned when the ICPD program of action is updated? So young people first asked for youth economic empowerment. Young people asked for youth sexual reproductive health rights. Young people asked for change and quality education.
What the future holds in terms of changes in population growth, contraceptive use, and sexual and reproductive health and rights will both determine and be determined by the ability of women and girls to achieve their full potential as members of their societies.
Despite the remarkable progress, we all know that we still have a long way to go before we can claim to have finished the business of the global reproductive rights and gender equality movement.
The SDG calls on all of us to leave no one behind. And yet we are witnessing persistent and in some cases powerful efforts to strip away hard-won gains in access and to prevent meaningful access to groups who continue to be marginalized, including the poor, people with disabilities, and adolescents.
About the state of inequality in our country is huge among regions and when it comes to urban to rural. This area is an area in which we have to address and we have to narrow the gap.
A lot has been achieved. Now millions of women have access to information and services, but still a lot remains to be done. We have to improve in many ways in terms of quality of service and making services accessible to those who are marginalized, underserved population. But still we have also to work in other aspects of like the economic and the social aspects so that women can be empowered and the young people and men can be empowered and have access to reproductive health services.
We certainly still want the same 3 zeros. But again, we want the intersectoral work. I mean, we work. Young people have gotten together from different sectors to try and tackle our own issues. Young people from private sectors, young people that are working on health, young people that are working on the economic development aspects, all work together to try and change some of our issues.
Recommendations were forwarded by the panelists in addressing the challenges and fulfilling the promises in the pursuit of rights and choices for all.
I think we have to have a stronger partnership and improve the access to reproductive health. I think one of the areas, always I mention this issue, the Minister of Health assumes that it is on its concern or it has to carry all the burden. As you know, the population of Ethiopia is growing very rapidly. Every year we are increasing one small African country. So the number of, the sustainability, even to maintain what we achieved now is, it needs more resource, more facilities, more human power.
for all of us to be able to function, we need an enabling environment, and that starts with the policy framework, being able to at least open up enough to get young people to engage meaningfully. We want to be a part of the planning, the implementation, the monitoring, and evaluation.
I want to take this opportunity to thank UNFPA for supporting us in this regard. Finally, I wish to conclude by pointing out that while Ethiopia has made substantial demographic and socio-economic gains since the adoption of its national population policy, the country still faces a lot of challenges that require serious attention and commitment of the government and all concerned partners to reduce poverty and improve the welfare of the society, while at the same time supporting the pursuit of rights and choices for all.